Do you have lower back pain that starts really low, like below your belt line? When you push on one side or both sides down on the back of your butt, do you feel pain there? And does the pain maybe radiate halfway or even a little bit more down your leg? If so, you might have sacroiliac joint pain, not necessarily lumbar spine pain. Hey, my name is Lucas. I'm a yoga teacher. People come to class all the time with lower back pain, and about 1 in 5, about 20% of the time, instead of being lumbar spine problems, they actually have a sacroiliac joint problem. The reason that's important is because this joint is very, very different than these joints, both the function, the dysfunction, and the healing. And so that's why I always like to differentiate. And in this video, I'll walk you through the differences, I'll walk you through the problems, and most importantly, I'll share with you some important corrective exercises to recreate stability down here on the back of your pelvis. Before we get started, just a quick disclaimer. If you're having serious pain or problems, please always work with a trusted healthcare provider. This video is just for educational purposes based on my experience as a yoga teacher. Okay, let's get into the anatomy. On the back of your pelvis here, if you take your hand and kind of form it into a little bit of a shape like this, and you imagine 5 fused vertebrae. So these vertebrae, they fuse actually quite late in life, like late adolescence, sometimes in your 30s or your 40s. But basically, by the time you're my age, on the back of your pelvis, you have a back door bony plate. And that door analogy is actually very helpful. We'll come back to this again and again. So on the back of your pelvis, those 5 vertebrae, they make one big bony plate. And where that sacrum, that bony plate, where it meets your ilium, the elephant ears of your pelvis, that is the SI joint. A joint is where 2 bones meet, your sacrum and your ilium. Why is this important to differentiate between your lumbar spine and your sacroiliac joint? Because the way they move is so different. Up here in your lumbar spine, your spine can flex and extend and slither and axially rotate. Down here, not so much at all. It's kind of like a closed door back here. Anatomists argue about the amount of movement that the sacrum has, but it's very little, no matter who you talk to. Maybe 2, 3, maximum 5 degrees of movement. So very, very little, which means that when it moves more, that's a huge problem. As a yoga teacher, of course, people often come to me asking for stretches to loosen up their sacrum. That's a really bad idea. That would be like if you had a door that had come off its hinges and you came to the repairman and you said, hey, can you make the door more wobbly? That's not what we want. We actually want to reinforce the door. We want to stabilize and rebuild the frame, tighten up the hinges so that the door is stable and creates a nice structured base on the backside of our pelvis. So this is what we try to do with our sacroiliac joint as well. Okay, so why is this area so prone to injury? Why does it happen, let's say, 20% of the time when we have back injuries? Lots of different reasons. One of the most common times when this occurs is during pregnancy. In pregnancy, there's a hormone that's released called relaxin. And relaxin is a very interesting hormone in that it loosens up your soft tissues. This is great for opening up the birth canal so the baby can pass. This is challenging because it also loosens up that back door of your pelvis and can lead to dysfunction, inflammation, and pain that you might have to deal with long term. Another common cause of sacroiliac joint pain and dysfunction is when someone has had a spinal surgery, specifically a spinal fusion. Really commonly, if somebody has chronic lower back pain, one of the common surgeries is to fuse, to bolt together 2 or more vertebrae upstream. That might do a great job of alleviating the pain here, but unfortunately, that lack of movement here can often translate to pressure down here, which again can knock that door off its hinges. What are the other ways you can injure your sacroiliac joint? Well, all the ways that we injure any joint. The one difference with the sacroiliac joint is it very often happens with unilateral movements, injuries, impact. What I mean by that is less likely to happen by landing on both legs, much more likely to happen by jumping off the roof of a house and landing on one leg, or happening in a yoga class when you're flexing, laterally rotating, and then with force, pulling on one leg. Essentially, if you think about tweaking with asymmetry, so one side rather than the other. This can happen in car accidents. It can happen by being hit. It can happen also in movements that demand unilateral pressure, so not on both sides, but one side more than the other. This bony plate is stabilized with ligaments. Ligaments are bone-to-bone connective tissues, and I like to think about them like leather belts. It's really, really strong. It has a little bit of elasticity, but it's mostly plastic. And what that means is when those ligaments, those stabilizers, those bone-to-bone connective tissues, when they get overstretched from birth, when they get overstretched from trauma, when that door gets knocked off its hinges, now they've been deformed. And then you can have what's called joint laxity, where that back door wiggles and wobbles on its hinges instead of being firmly in place. And that wiggly, wobbly door, it still works. You can open and close it. But every time you open and close it, there's a little bit more damage around the frame. Every time you open and close it, the wood frame starts to fray a little bit. That same sort of thing can happen here. Inflammation, articular cartilage can wear down. You can get osteoarthritis, all kinds of different things can happen. So the name of the game usually is not so much to stretch, but instead to stabilize, to strengthen, to reinforce. Well, we can't contract ligaments. We have to let its body do its own healing process, which unfortunately is really slow. And in the meantime, we need to call in the reinforcements, which are the muscles that surround the sacrum, to pick up the slack. What do I mean by that? Well, again, let's use this analogy. The door is wobbly, it's off its hinges. Let's go in and reinforce the frame. Let's tighten up the hinges, and we'll do that by focusing on two specific muscles. These are not the only muscles involved, but they're the two that we'll focus on today. And the first one is your glute max. That's your big butt muscle back here that's involved in hip extension. But because it also attaches to your sacrum, when it gets stronger, it can tighten up and stabilize this region. And the second one is our piriformis muscle. This unusual muscle starts on the anterior side of your sacrum, crosses and attaches onto your femur. It's largely responsible for lateral rotation of your hip. But again, because it's attached here at your sacrum, when it gets strong, it can also serve as reinforcements, as a stabilizer for that sacrum as those ligaments heal and our back door of our pelvis starts to get more stable. Let's jump in and look at some corrective exercises. Just one caveat before we jump in. These exercises assume that you're in pain and that you want to take things very, very slow. Almost certainly you will graduate from these simple exercises and you'll progressively add more force, add more load, do things that are more intense. But remember, with joint pain, all pain is bad. When we're doing corrective exercises, if the exercises make it worse, they're not good. When you're working with muscles, sometimes no pain, no gain is true. When you're working with joints, all pain should be treated like a red light flashing and you want to back off. So we'll start very slow, we'll start very mild, and step by step, you'll be able to progress. Let's take a look. The first practice we'll do is called a sit, stand, and thrust. Just like the name sounds, we'll start in a seated position, we'll stand up and then thrust our pelvis forward. But please do this very slow and very controlled. I'm sitting on the edge of a chair. My knees are bent at 90 degrees, not more, so 90 degrees. My feet are planted flat down and I drive the weight into my heels. I sit, I stand, and I thrust. If you take your hands back behind you, you should feel your glute max fired up, that first muscle that we chatted about before. We'd also like to take our piriformis muscle online as well. And remember, that's a lateral rotator of your hip. To do that, I'll use a rubber band here. This is a fitness band. Anything you buy works just fine. I like these thin ones because you can use them for lots of different things. I've tied mine in a knot just to make it a little bit shorter, and I'll double it up and watch what I do. I'll place it between my legs just above my knees. Why am I using this? Because in order to keep my legs apart, I need to engage that piriformis lateral rotator of my hip. So this will help me to strengthen both glute max and also my piriformis at the same time. Feet are as wide as my hips. I drive my heels down. I sit to stand to thrust. You can feel those muscles engage back behind you. Sit to stand to thrust. I'll do these in sets of 10, 3 sets of 10 every day for a week. You really have to take it easy at first. Remember what we're trying to do here. We're trying to build strength and tension in your glutes and your piriformis to make up for the laxity in the ligaments around your sacrum at the moment. After a week, if you're feeling okay, you might start to add some load. If you have a kettlebell or a barbell in your house, a dumbbell, you can hold that in your hand. If you don't, grab a box, put something heavy in it, Start off with, I don't know, 5 pounds, 10 pounds, something like that. We'll sit, we'll stand, we'll thrust, and again, we'll work daily, and slowly, progressively, you can build up to load. Now notice we're moving in a symmetrical pattern, so we're doing bilateral instead of one side and the other side. This is by design. Okay, let's look at the next exercise. The next pose we'll take a look at is simply called clamshells. I'll use the exact same band that I had before, and I'll position it in the same place, right above my knees. I'll lie down on my side and keep my feet together, but I'll clamshell, like the name suggests, with my knees. So my knees come together, apart. You can place your hands back here and you can feel specifically that piriformis muscle contracting as you open and close. Open and close. I'd like you to do 10 on either side, 3 sets of 10 on both sides, clamshells every day. Again, this is a very gentle exercise, but really helpful for creating more stability around that joint. This final pose is called banded squat walks. I've got my exact same exercise band. I will put it between my legs, right above my knees. And then this time I'll separate my feet a little bit wider than my hips. I'll hinge at my hips so my bum sits down and back. Place my fist into my palm. I'll then walk to the right with control. 1, 2, 3. I'll then walk to the left. 3, 2, 1. Do a total of 5 sets per day. Take it really easy. Keep in mind that these banded squat walks, they look a lot simpler than they are. If you're dealing with an SI joint pain, if you feel pain, back off and stick with the first 2 exercises. Hope you found this video helpful. If you'd like more science-based yoga videos, please hit subscribe down below, hit that like button, and if you have questions about any of the poses that we've covered, please just ask down below. You can always find my teaching schedule at yogabody.com, and I'll see you in the next video.